As the Delta variant spreads and cases spike among the unvaccinated, fewer Californians are dying from the virus. We're taking an in-depth look at several factors that may be saving lives. The newest addition to San Diego's waterfront opens tonight after a one-year delay. What the Shell will offer from performances to park space. The old Palomar Hospital is out as Escondido takes another step toward revamping downtown. Details of the project and the action that advanced it today.
ABC 10 News at 6 starts now.
The Delta variant is more contagious than the original strain of COVID, and the CDC says it's likely it's more severe as well. But as cases spike, the number of deaths in California has remained flat. Good evening, I'm Kimberly Hunt. ABC 10 News anchor Derek Stahl is going in depth on the factors shaping the variant's severity.
At family health centers in Hillcrest, they're seeing patients with a wide range of illness from the Delta variant, some with mild symptoms.
And right next door to them are 30 and 40-year-olds that are sick as dogs and really look like a truck ran over them, coughing like crazy. Compared to last year, I think we're seeing sicker people.
An internal CDC document last week said Delta is likely more severe. The assessment was based on 3 studies from Canada, Singapore, and Scotland. In each study, the researchers adjusted for age, gender, and other risk factors, and they found people with Delta had a much higher risk of hospitalization than those with the original virus. Nearly twice the risk in the Scottish study, even higher in the Canadian study.
We know for sure the viral levels are higher. It seems to make people sicker more quickly. So, 3 days on average, 3 to 4, rather than 5 to 7, which was from the older version there. I do think that's going to translate into more severity of illness.
But Dr. Christian Raymer says it's still hard to say for sure. The 3 foreign studies were somewhat limited and haven't been peer-reviewed. Across California, cases have been spiking since the beginning of July, and hospitalizations have ticked up too. But the death rate from COVID has stayed pretty flat since June. That's partly because deaths are a lagging indicator. After an infection, it typically takes about 3 weeks for someone to die from COVID, but it may be something else.
The pool of people that are getting COVID is by and large unvaccinated people. And that tends to be more the 20 to 30-year-old folks.
He says hospitals may be seeing younger, more resilient patients. More than 70% of Californians over 50 are now fully vaccinated.
It may be that we have a very well-protected vulnerable population, so deaths won't go up that much. And I know we now have treatments that are better than they were before.
He says treatments like monoclonal antibodies are more readily available for high-risk patients soon after infection. The infusions can even be given to people who have been vaccinated, an extra layer of protection that makes Delta's severity a little harder to calculate. Derek Stahl, ABC 10 News.
And doctors say Delta's extraordinary rate of spread also makes pinpointing its severity more challenging because more infections naturally lead to more hospitalizations. There were nearly 1,500 new local cases of the virus just today in San Diego County. Severe cases also seem to be on the rise. 50 more people have been hospitalized and 4 more San Diegans have died. As cases rise, the county has reopened a free walk-up testing site at San Diego State. It's located at SDSU Alumni Center. It's the 3rd large capacity testing center the county has opened. The others are at Cal State San Marcos and the Tubman Chavez Center. The SDSU and San Marcos locations are open Tuesday through Saturday. The Tubman Chavez Center is open Sunday through Thursday. And all of these locations are open from 10:30 to 5:30. Coronavirus booster shots could soon be authorized for a certain group of people. We are taking an in-depth look. Federal health officials are expected to recommend boosters for immunocompromised Americans within weeks. And that includes those who have gotten organ transplants, cancer patients, and those with certain diseases. About 7 million Americans fall in that category. Many with weakened immune systems haven't responded to vaccines, leaving them vulnerable to the virus. But studies show a 3rd dose could make a difference. It's something the vice president of Sharp Healthcare System Pharmacy supports.
When we give them that third dose, it's another signal to their body to make those antibodies. And we're seeing with the third dose in that very small group of patients that that's beneficial. And then they do start to show the antibodies to the coronavirus.
Research reported in June in the Annals of Internal Medicine showed out of 30 people who got an organ transplant, just 6 had antibodies after being fully vaccinated. But 2 weeks after a third shot, that number jumped to 14. Another June study in the New England Journal of Medicine showed that 67 out of 99 organ transplant recipients had antibodies after a third dose. That's compared with 4 of 101 after a first dose and 40 of 99 after a second. The CDC Vaccine Advisory Panel is meeting in a week to hear about more data related to boosters. National City is giving out thousands of masks to students as the Delta variant continues to spread there.
It's about going back to basics. As an athlete, it's about fundamentals. Masks was the first thing that we talked about that would help protect our students, our youth, and our elders. So we need to make sure that as schools open up, they have the resources and the tools to stay safe.
More than 46,000 masks were handed out today, and more will be given in the weeks to come. And as an incentive for students 12 and older to get vaccinated, the city will be giving out Amazon gift cards tomorrow. The free vaccination event will take place at 2815 Highland Avenue from 8 until noon. You can keep up with the changes in the pandemic and how agencies adapt to it with the ABC 10 News app. A free version is available in the App Store. A SWAT standoff in Choya's View ended with a man in custody in the last hour. It started just after 9 a.m. on 48th Street. Police say the family told them their uncle was having mental issues and threatened them with a machete. They got out safely and no one was hurt. San Diego police say they arrested a man involved in what they have described as a hate crime against a woman at Mission Beach bonfire. Investigators say the attack happened Monday night. Police originally released this picture of their suspect and today said they arrested 20-year-old Jose Ira. They say he pulled out a handgun and pointed it at one of the people at the bonfire. Investigators are also looking for a man who hit a woman in the eye with a tossed beer can. Investigators say the two were part of a group of young men who approached the bonfire and began yelling anti-LGBTQ slurs. Today, we talked to the Sheriff's Department about the disturbing body camera video they released yesterday that shows what happened when a deputy was exposed to fentanyl. Deputy David Five Eye found a white substance he suspected was drugs in a red Jeep. And while it's still unclear exactly what happened, the Sheriff's Department says it illustrates just how dangerous fentanyl is. The department says it has changed its testing procedures and it requires the use of protective equipment.
We always have someone else present when we're testing the drug. As you saw in the video, there was another deputy present. He had the presence of mind to have the naloxone handy and ready to go.
The Sheriff's Department doesn't use canines to detect fentanyl because of how toxic it can be.